Welcome to Health Bulletin. Today, we're going to see some of the most pressing issues that making headlines around the world. From alarming developments of mutation in H5N1 to groundbreaking advancements in cancer treatment, we've got you covered. A concerning report from Canada where a teenager who contracted the H5N1 bird flu virus has fully recovered after being admitted to an intensive care unit earlier this November. While her recovery is certainly a relief, but the genetic analysis of the virus that infected her has raised some red flags. Researchers have identified ominous mutations in the H5N1 virus, which they describe as worrisome. These mutations may enable the virus to target human cells more efficiently, potentially leading to more severe illnesses. Listen to what the WHO has to say about the rising concerns surrounding H5N1.
Improving surveillance and strengthening biosecurity on farms are critical in keeping both animals and humans safe. In 2024, 76 people have been reported to be infected with H5 avian influenza viruses. Most of them were farm workers. While there is much attention on the avian influenza situation in the US, this year cases have also been reported from Australia, Canada, China, Cambodia, and Vietnam. We are recommending to our member states and national authorities to increase surveillance and vigilance in human populations, especially those who are occupationally exposed. We strongly advise that thorough investigations take place around each and every human detection to assess the possibility of human-to-human spread. Cows infected with the H5N1 virus have been reported to have high viral loads in their milk. It is important to reiterate our long-standing advice to consume pasteurized milk. If pasteurized milk isn't available, heating milk until it boils also makes it safe for consumption. Similarly, we recommend thorough cooking of meat and eggs when an area is affected by avian.
Shifting our focus to latest update coming from South Korea, where investigators are intensifying their probe into the tragic Jeju air crash that claimed 179 lives, marking the worst aviation disaster on the nation's soil. The ill-fated flight was carrying 181 passengers from Thailand when it issued a distress call and attempted a belly landing before colliding with a barrier and igniting in flames. Thankfully, 2 flight attendants were rescued from the wreckage. In a recent development, authorities have decided to send one of the recovered black boxes to the United States for further analysis, as domestic efforts to extract data from the damaged flight recorder proved unsuccessful. South Korea's Deputy Minister for Civil Aviation stated that the data extraction was not feasible locally, prompting the involvement of international experts, including those from Boeing, to help piece together the events that led to this devastating accident. Turning our attention to global health, the WHO is once again asking China to share data on the origins of the COVID-19 virus that changed society 5 years since the start of the pandemic in Wuhan. Listen what Dr. Tedros addressed in his recent briefing.
Is the world better prepared for the next pandemic than we were for COVID-19? The answer is yes and no. If the next pandemic arrived today, the world would still face some of the same weaknesses and vulnerabilities that gave COVID-19 a foothold 5 years ago. But the world has also learned many of the painful lessons the pandemic taught us and has taken significant steps to strengthen its defenses against future epidemics and pandemics. Together with the World Bank, WHO established the Pandemic Fund, which is now financing 19 projects in 37 countries with $338 million in grants. WHO has supported many countries to strengthen their lab capacity to detect and sequence pathogens, and we established the WHO Hub for Pandemic and Epidemic Intelligence in Germany to foster collaborative surveillance, to improve local production of vaccines and other medical products. We established the mRNA Technology Transfer Hub in South Africa and a global training hub for biomanufacturing in the Republic of Korea. To improve equitable access to life-saving tools, we established an interim medical countermeasures network. With partners, we established the Global Health Emergency Corps. In May this year, the World Health Assembly adopted a package of amendments to the international health regulations. Our member states continue to negotiate the WHO pandemic agreement. They are committed to finalizing the agreement in time for the World Health Assembly next May. I remain confident that they will.
Meanwhile, China Foreign Ministry has announced in press briefing that it has shared the majority of its COVID-19 data and research findings with the international community.
5年前，新冠疫情爆发后，中国第一时间向世卫组织和国际社会分享疫情信息和病毒基因序列，毫无保留地分享防控和诊疗经验，为国际社会抗击疫情做出了巨大贡献。
In December 2021, nations began drafting a comprehensive accord on pandemic prevention, preparedness, and response. Despite consensus on the treaty's framework among the WHO's 194 member states, debates persist over implementation, particularly between wealthier nations with major pharmaceutical industries and poorer countries concerned about equitable access to pandemic resources. The deadline for finalizing these negotiations is May 2025, with a strong emphasis on ensuring rapid sharing of emerging pathogens and fair distribution of resources to combat future pandemics. Finally, in the field of medical research, a groundbreaking advancement has emerged from South Korea's KAIST. Despite numerous cancer treatment technologies, the conventional approach aims to eliminate cancer cells, often leading to resistance and severe side effects by harming healthy cells. On December 20th, KAIST President Kwang Hyung-lee announced that Professor Kwang Hyun-cho and his team from the Department of Bio and Brain Engineering have developed an innovative technology that treats colon cancer by reverting cancer cells to a state resembling normal colon cells rather than destroying them. This novel concept of reversible cancer therapy offers a promising alternative, potentially minimizing side effects and reducing the likelihood of cancer recurrence. This breakthrough represents a significant shift in cancer treatment paradigms, emphasizing restoration over eradication. If successful in further trials, this technology could pave the way for more effective and less invasive cancer therapies in the future. These stories highlight both the challenges and breakthrough happening in our world today, from battling emerging viruses and ensuring aviation safety, to fostering international cooperation in health and pioneering new medical treatments. If you found this video informative, please give it a thumbs up, subscribe to our channel for more in-depth analyses, and don't forget to hit the bell icon to stay updated with our latest content.